Good morning, everyone. We are recording this Brunch and Learn with Community Action on the topic of transforming homeless services in Skagit County. So we will be able to share that link in the future. I'm so glad that all of you could join us. I'm Liz Jennings, Director of Community Engagement at Community Action. And as usual, my brunch is a really, really big cup of coffee. If you all do want to have a snack or a cup of coffee, that's great. If you want to take yourselves off video, that's fine as well, but we're so glad that you're all here. These Brunch and Learns are monthly time for us to look at a big picture community issue, a problem that we're trying to solve together, what we're all doing, nonprofit organizations, government agencies, businesses, how we're collaborating across the community to deal with that issue. And specifically, it's a deep dive into community actions, programs, and in this case, service delivery model, to learn a little bit more for our own staff, our partners, and others who are interested about community actions piece of these collaborative solutions. Do feel free to introduce yourself in the chat. You can grab information from other folks. We hope that you build your relationships and networking in these sessions as well. And today's topic is transforming homeless services, care coordination and coordinated entry. At Community Action, we like the word coordinated almost as much as we like the word community. Our speakers today from Community Action are Marissa Davidson, Education and Employment Manager, Dulce Vasquez Cruz, Resource Center Manager, Vernon Hunter, a Care Coordinator and Department Service Officer with Skagit Vets Connect, Stephen Simmons, Outreach Programs Manager, Melissa Self, Deputy Director, and we may have other staff popping in to answer questions along the way. And so glad to see so many of our homeless service provider partners are here today too. So we will, if you've got questions, we thank you to those who submitted questions ahead of time in the registration. Hopefully we address most of those questions in our presentations. And if you've got other questions, you can put them in the chat or wait until the end. We will have about 15 minutes for Q&A. We will note that if there are questions that are outside of Community Action's bailiwick, outside of our scope of service or outside of our mission, we may refer those questions to our partners who are here or follow up with you to help you get more information later. So I'm not going to go too much into detail about Community Action's overall programs and services today because of the focus that we're going to have, but a reminder that anytime that you are curious about Community Action's programs, you can go to our website and Isabella will drop that link into the chat. So I'm going to start out, and rather than us talking about care coordination and coordinated entry and telling you what it is, we're going to talk about why we do it. And I'm going to start, so this is a little bit of a story time with Community Action. I'm going to start with Marissa Davison. And Marissa, introduce yourself and your program and tell us what care coordination looks like in action and the impact it's made in one of the lives of the people you serve. I can't hear you, Marissa. Okay. Yep, we can hear you. Thank you. Oh, you just put yourself back on mute one more time. Well, while you are working on that, maybe we will ask Vernon from Vets Connect to go first.
Hey, good morning. Can everyone hear me okay?
Yep, we can hear you.
Hey, I'm a excited care specialist here at Vets Connect in Burlington. And I would like to, start your video. Can you see me?
Nope. There you are.
There you go. Okay. went off for some reason. So I wanted to share a couple of veteran life-changing story that where we used care coordination to try to help house two veterans in Cascade Landing here in Burlington. Um, we had one veteran that had a couple of high barriers, and trying to get the veteran, it was a referral to us, and trying to get the veteran housed was going to be a daunting task. But we were able to provide this veteran with a subsidy through our Veterans Assistance Fund. From the county. And also, he was actually, and I'm proud of this, he was the very first tenant to move into Cascade Landing. Um, Bear in mind, again, very high barriers, and this veteran needed a place to live. And we were able to find housing for him in Cascade Landing.
And
Now,
Vernon, I'm going to interrupt for just a second. When you say
mhm.
barriers, and I know you need to keep confidentiality, but can you just talk in general about what some types of barriers to housing might be that you see that veterans have?
Sure, Liz. One of the barriers was very low income. Okay, very low income, and that's where we were able to help with a subsidy. And there are other barriers out there that records, criminal past, that may be a barrier or may not be a barrier to housing. However, and that's what Landing is designed for. You know, we in care coordination, we try to get over those barriers, move those barriers to the side to give them an upper hand again, and give them about a year's worth of lease experience. So if they needed to move on to a larger space or needed to move on somewhere else, they would have a rental history. So that's what's so good about this. Moving on to the next one, I have a gentleman, and by the way, these two veterans are under care coordination, and my job with them is to ensure that they are employed or seeking additional employment for a higher rate wage, so they can afford housing next year. The next veteran, I have a veteran that worked at Home Depot. Definitely a high barrier because of a divorce. He was living with someone, and that person was told to leave, and so he had to leave. So he was really desperate. Otherwise, he was going to be homeless. But he had 6 years with Home Depot, and we were able to get this veteran housed as well. Great positive. My story to this, it may be my story to this, we help veterans, but I also want you to know that our reservists out there in the state, we support them as well. He was a reservist, and we were able to support that reservist who is, on state standby all the time to be called up by the governor or even the president. And so we were able to make him eligible for the program. And by the way, he was one of our first in a couple years. So we're very proud of that. So anyway, my case management with him is that he's working towards a management position at Home Depot. I think it was Lowe's, though. I'm sorry, Lowe's or Home Depot. Um,
He had a job. We'll,
he
we'll,
he
we'll
had a
get a
job, but a very high barrier in trying to get a place to live, affordable place.
Well, it was great to start with you, Vernon, because you mentioned partnerships, that it was because of working with some county programs that care coordination involved. walking alongside folks and helping them understand their barriers and looking for solutions to that, being a support, and then helping them to get into stable housing where they can build that rental history and then perhaps move on their own. Marissa, are we able to hear you at this point?
Let's hope so. Are you able to hear me now?
Yay.
Okay. I
All
just
right.
took my headphones off and we'll just do it without headphones then. Well, thank you, Liz. So my name is Marissa Davison, and I am the Education and Employment Manager with Community Action. I am really happy to present here today and show some of our successes within our employment and education programs. One in particular that I am extremely proud of, and extremely proud of my team as well, and what they've been able to do within Community Action. We have one participant that we've worked with who came to us in a time with, just like Vernon's participants, many barriers. And it started out where this participant was chronically homeless, was going through different bouts, and had 4 children. With this participant, we were able to work with them to get them set up with a lot of our community partners. These are ones such as DVSAS, which is the Domestic Violence and Sexual Assault Services, and DSHS, the Department of Social and Health Services. Through their support and our connection with them, we were able to work with them to find temporary housing at the time, and then slowly working in the process, working towards permanent housing. And also we've been able to get them subsidized employment, and we are currently working with them to find unsubsidized employment. So those are really great successes. This person has done such an amazing job in just a matter of about 6 months, 6 to 7 months. So that's a huge progress that this person has made. Other ones that we've had are, we've had people.
Marissa, I'm just gonna pause for a moment. What is, did you say supported employment, subsidized employment?
Subsidized
What does
employment.
that mean? That's jargon to Liz.
Yeah. So that's a good question. So with subsidized employment within the employment program, it's typically where we have this participant who they're gaining employment through some sort of funding. For instance, this participant was on temporary assistance for needy families, or TANF, you might typically hear it referred to. And unsubsidized employment is being able to find employment pretty much on their own and having a full-time position without any government or agency assistance.
Okay, keep going. You were going to tell us another story too.
Yeah. So we've had a bunch of different participants with very similar situations. Unfortunately, this is not a very uncommon circumstances that we work with. So we've been able to connect with our housing team and a bunch of other services within Community Action to get them the needs the needs that they need to be able to get past those barriers and learn different concepts in order to gain full-time employment and gain housing. Another participant that we've worked with is someone who came to us in a different way, who was interested in finding different employment. They were actually already employed and struggled with a lot of different barriers, such as a lack of employment history, wanting to help take care of their parents, because right now they were living at their parents' home, and there were some issues with them getting older and needing some assistance to find a better job to be able to support their family. So with this person, they have some concerns and some issues when it comes to mental health. So we really focused on trying to get them mental health services with some of our partners, such as Consejo Psychological Services we've worked with. They've been so gracious in being able to get them in, because that's a really difficult thing. Right now, it seems that a lot of places are filling up fast, which is great. I'm glad people are accessing those services. But we were able to get them in fast and timely, and have started to work on the job search and officially put in their very first application.
Well, congratulations to that program participant and to the team who's providing that care coordination. And again, walking alongside, seeing what that participant's goals are, centering that person and their future, and then looking to connect them to as many services within Community Action, as well as with those other partner organizations. Thank you, Marissa. I'm going to turn next to Stephen Simmons, our outreach programs manager, and tell us what care coordination. First of all, tell us what outreach. So we've heard from Vets Connect. We've heard from employment. What is Community Action's outreach programs? And then maybe tell us a story or two of what care coordination looks like within your program.
Sure. So, Community Action's outreach programs work directly with the unhoused community where they're at, which literally means going out into the community, into the places where folks are living. Sometimes that looks like encampments, sometimes it's, parking lots on the sidewalk. We go and we find folks where they're at. We kind of have two programs. One is just like typical outreach, which is going out. We have hot drinks, sleeping bags, tents, things that people need to get their immediate needs met to make it through the day, basically. And so we go around and find out what we can do to help folks just make it through the day. We're building relationships, hopefully to have like a scaffolding of a relationship set up for when this person is ready to seek some services, so that we'll be able to help them with some case management on the basis of trust. The other part of our programming is the Skagit Recovery Navigator program, which is an intensive case management program. It runs on a referral basis. Liz is screen sharing the referral form right now. And anyone in the community can make a referral into this program. It's the form is set up where, you may just have a little bit of information. It would be like, I work at Shell and there's an older gentleman in a camouflage jacket out there every morning around 8 or 9 o'clock. He looks like he could use some help. All the way up to, we get them from DCYF and, they have a very intimate relationship with the person that they're referring. It could give us a ton of information, to law enforcement referrals. It just really depends, but it's set up to where you can have very little information or a lot of information and still get a referral made. And then you just go down and click submit, and a case manager will follow up with you, as they seek to make contact with the individual that you're referring. And then
I'm going to take a quick pause here, Stephen. Want to acknowledge that our partners at the City of Mount Vernon started outreach programming for people without homes through the Mount Vernon Police Department. And I believe those friends are here today. And a number of our other partner organizations, homeless service organizations, have outreach staff as well. This is an area where Community Action has grown since the pandemic. How many staff members, interns, volunteers, what is your team size now, Stephen?
We are at 7 staff and 3 interns right now, I think.
So we've got 10 folks, and they're not limited to just one community. It's anywhere in Skagit County that you can go. Is that right?
Absolutely.
All right. So tell us in a couple of minutes here, maybe 1 or 2 stories of what that kind of relationship building and care coordination looks like, and the difference it's made in someone's life.
Sure. So I think that the relationship building piece is really crucial, and that's a lot of the work that we're doing when we're out in the street doing just the typical outreach, and, when we really see that come to fruition is, say, we've been running into somebody for 2-3 months out in the street. Maybe they've only been wanting a snack bag and hot drinks when we see them. They've been sort of standoffish, haven't really wanted to engage much. And then this person may show up at our lobby hours and, be ready to get into detox or to try to see a medical doctor. They might have something going on with their physical health where they're like, I just really need some help accessing services, and so that building relationships thing is crucial. A lot of our clients, feel like they exist on the margins, if not completely outside of society, and feel like all doors are closed. So it's takes some time and takes just some persistence, to get out there in the street and make relationships with folks. And then when we get into care coordination, I think a lot of people have already talked, you know, it's really about finding those specific barriers that people face. You know, right now we're helping somebody from East County get their driving school done. They've never driven a car before, and so they want to get their driver's license so they can work, and they really want to take classes, but they're, you know, working as a dishwasher, and that's kind of outside of their ability to pay. And they're currently unhoused working. Getting his driver's license is like the next step towards more stability for them, right? So we're helping with that. You know, we've partnered a lot with the Mount Vernon Police Department team. You know, they were instrumental in helping us get a couple of clients their birth certificates from out of state because they were able to receive the mail. So that was a huge help. You know, we're getting people into medically assisted treatment, and often that looks like going down to Island Crossing in Arlington and getting services established there, and then transferring to Dijwalik because it's more local. But the Arlington Clinic has like more available drop-in hours than they do. So
and Stephen, just for folks who aren't in the business, what are those two facilities? What is medically assisted treatment? Why is this important?
Medically assisted treatment is Suboxone, methadone, Vivitrol, basically any prescription that's going to help folks in their recovery. You know, it's and then Dijwalik is located in on the way to Anacortes. That's the Swinomish Tribes facility for medically assisted treatment. They do methadone and Suboxone services. And then Island Crossing is located at the Arlington exit. And yeah.
So again, it sounds like the people that you're working with, people without homes, you're saying sometimes can be standoffish and don't want to engage even when being offered the front door to resources. And it takes some time to build that relationship and to build that trust. And meanwhile, your team's helping to keep those folks alive, providing some much needed supplies, food, warmth. And that in turn helps build that trust so that they're willing to eventually opt into care coordination where they set a goal, like I want a driver's license or I want a class, or yeah, I'm ready to say yes to a recovery program. So thank you so much. And any last words before we move on to actually talking about what care coordination is?
I think we're good right now. Let's keep it going. Thanks.
All right. So really, that's the takeaway. This is care coordination. Community Action has been doing care coordination and been building our chops with care coordination. And it's essentially putting that person at the center of solutions to set a goal. And we've been in a 1-year process of transforming our entire organization, Community Action's entire structure, to do more of this, to build on the expertise that we've already got with folks like Marissa and Vernon and Stephen and all of our programs that have been providing that wraparound care. But now it may be available to more and differently. So Melissa Self, our Deputy Director, what is care coordination and how is Community Action transforming?
Well, you've just heard some stories about what exactly care coordination is. And like you said, Liz, yeah, we've been doing this all along. And but we've been rather restricted to doing it to folks who have been able to get into a program per se, whether that's a housing program that comes with the rental subsidy. They would be teamed up with a case manager that would work with them to help them find housing and become stable in their housing. Whether it was when they got if they were able to get into a shelter, if there was an opening in our shelter, they would work along a case manager and set goals and try to get out into some permanent stable housing, or with our employment program. Often those programs don't have openings. And so folks would come in and do a coordinated entry for homeless services intake, which we'll talk a little bit more and describe how that system is working. And, you know, sit on the list and in hopes that one of these programs or a program in one of our partner agencies, a shelter opening, a housing program, would open up. So we were serving, I think maybe a third of the folks that ever got onto the housing interest pool were able to have someone walk alongside them, navigate them, help them navigate services. We have a new partnership with the Accountable Communities of Health and some other opportunities that we're being able to expand those services. So we are working to increase our staffing levels and to where we are taking referrals off of the housing interest pool, even if folks haven't been able to get into a program per se. So we started kind of building our team and learning a lot of lessons from a partner agency out in Aberdeen, Coastal Community Action, who have been doing this for about 7 years. And we have started making referrals in January. So by February, we had 17% of the housing interest pool had been referred to a care specialist or a case manager, and are now working with folks, whether or not they've been entered into a program. And so they can start working on getting some of those needs met, getting them connected with physical behavioral health services, other mainstream benefits, other resources that we have in our communities that can help them and try to move forward. By the end of March, we had 22% of the housing interest pool had been referred to a care specialist, and we are continuing to staff up. We hired another new staff member just this week that will start taking a caseload and help us build more capacity. So it's been very exciting. To be able to help folks that aren't just sitting on a housing interest list.
So we're going to hear a little bit more about that. We're going to go to Dulce, who's going to tell us what coordinated entry and that housing interest pool is. But I just want to take a minute and celebrate. I think I saw Gail Smith was on the list of folks who are RSVP'd. I don't know if Gail is on the call today, but Gail, when on our board of directors, encouraged us to take a minute to plant a flag and celebrate a victory, because this is a really freaking big deal that we had a housing interest pool of folks who are literally homeless, but we didn't have the community resources to provide case management for everybody on that list. And you're saying that in just a couple of months, 22% of the people on that list now are in care coordination. Can I have everybody give a woohoo, please, in whatever way your culture likes to celebrate? So I actually literally got chills just hearing that. So thank you so much. That's incredible. We do want to go and listen to Dulce explain what coordinated entry is and what some of the problems with it have been, which is why we've been doing this transformation. But anything else that you want to say, Melissa, about care coordination and the effort it's taken here at Community Action?
No, it's been a big change for a lot of our staff. I'm really proud of our staff that have been open and willing to make the change. They're doing more work out in the community and less behind their desks. So I just want to applaud those that have been early adopters and are helping to move this forward.
I think early adapter is actually a good way to say it too. There's been a lot of adaptation and evolution going on here at Community Action. And honestly, as someone who's not in direct services, one of the things that's been but very impressive to me, not only the frontline staff, but how it's taken every piece of the organization to say yes to change, from finance to IT to facilities. Like everyone had to buy into this because it's been such a big change. HR had to redo how many job descriptions, and the recruitment that we've been going through, it hasn't been easy. And I just want to say congratulations to all of Community Action for leaning in and doing this work for the people we serve. So we'll come back and hear a little bit more about care coordination. Dulce, I think you are in a new location, and we'll hear more about that later. Are you able to join us and talk a little bit about what coordinated entry is?
Hey everyone, and yes, my name is Buddha and I am the Resource Center Manager right now. We are co-rooming with Anacortes Family Center, and we're here in Anacortes with our Anacortes Resource Center. But anyway, back to coordinated entry.
What is coordinated entry for homeless services? I mean, coordinated entry is a phrase. It's a service delivery system, but community action didn't make this up, right? Like, we're going to talk with some challenges with the system, but what is it and where did it come from?
So it didn't come from. It wasn't an idea that was created at Skagit County or community action. This actually comes from the Housing and Urban Development, the HUD, and they said that, you know what, we need to coordinate our homeless services. So then they brought that down to the state level, and the Washington Department of Commerce said, all right, now 12 years ago, they said, let's make it optional. And then a year later, they said, now every county is required to have a coordinated entry system established in their county.
So this is from the feds through the State Department of Commerce down to the county level.
And then from the county level, then that's when they designate someone to be the lead agency for coordinated entry. And that's where we've been playing a role now for the past about 12 to 13 years. We've been playing that role, and we've seen and overcome some challenges with the coordinated entry system, because it is a system intended to serve our most vulnerable individuals in our community. Those clients are mostly clients without housing, or clients who are about to experience being unhoused. And coordinated entry is intended to serve them the quickest and fastest way without making their experience of being unhoused as short as possible, or preventing them from becoming unhoused.
So Dulce, I'm just going to pause for a moment. So coordinated entry, the idea is that it's one entry, so people, if I'm unhoused, I don't have to go around to every homeless service provider. I don't have to be an expert in homeless services. I don't even need to know what services are out there, but there's one kind of application, one entry, and that puts folks into the coordinated entry system. I have a list here. Should I show all of the partners that are involved with that?
Definitely.
So it's not just community action. We contract with the county to do this, but it really is a group effort. So can you see that?
Yeah.
Okay. So Anacortes Family Center, Friendship House, Northwest Youth Services, Samish Indian Nation, Housing Authority of Skagit County, Pioneer Human Services, Compass Health, East County Resource Center, Family Promise of Skagit Valley, Skagit Domestic Violence and Sexual Assault Services, the Oasis Teen Shelter at the YMCA, Skagit Legal Aid, Catholic Community Services, Helping Hands Project Organization, which is different than the Helping Hands Solution Center based in Skagit County, Skagit County Public Health. So those partners are all working together. And what happens if I am literally homeless? First off, what is literally homeless according to HUD? And then what happens if I come to one of those partners and I get into coordinated entry, then what? So let's start with what is literally homeless according to HUD?
So literally homeless by the HUD definition is someone who is sleeping in a place not meant for human habitation, which could be a tent outside, in their vehicles, abandoned buildings. They might even be parked in an RV illegally, and they have no hookup to their RV, or those are clients who are also fleeing domestic violence. Those individuals are also literally homeless. And based off of that definition, those individuals that go to one of our partnered agencies and say, hey, I'm interested in completing a coordinated entry intake, that individual only gets to tell their story once to that partnered agency. And then that assessment, then that information that we gather then gets distributed to all of the resources that are available to that household. So they get referred to multiple interventions at a time. That includes a shelter, referrals, and rental assistance programs. And
So this is what Melissa was talking about, that if someone is vulnerable enough, they might get referred into a program, and that's maybe a bed at a shelter or a rental assistance program. So the feds said, hey, resources are tight. We can't help everybody who needs help. So, hey, counties and communities, you have to create a vulnerability assessment. And based on that vulnerability, if there's help available, if there's one of these programs available, maybe you'll get some help. Would you say that in a different way, or can you expand on that a little bit, Dulce?
yeah, so when it came time to come up with an assessment and to find out what are the vulnerabilities that we're seeing in our community, we had the choice between using a standardized assessment tool that was being used, that was already built by the Housing and Urban Development, or we could create our own community assessment tool. And Skagit County went and took the lead on creating a community-based assessment tool. And that is the assessment tool that we're using now. It reflects the vulnerabilities that we're seeing in our community. Of course, that was 12, 13 years ago. In Skagit County,
and what are
a lot
some of those
now.
vulnerabilities? What's high on that list?
High on that list, what we're looking at when we're completing that assessment tool, and we're looking at safety factors. Are they safe in their current living situation? Do they have any physical or developmental disabilities, any chronic health conditions, maybe mental health diagnosis, or maybe some substance use issues? We're also looking at clients who are high utilizers of the system.
So what is that? A high utilizer of the system? What does that mean?
So those are individuals that are going to, let's say, the emergency room to meet their basic needs. So they are using these systems, they are to meet their basic needs because they're not able to meet them at their current living situation.
And now I know that Community Action has taken the lead, and it is a collaboration. And thank you, Stephen. We did add the Mount Vernon Police Department's integrated outreach team there, the OGs, onto our list. So we have these 16 partners with the Coordinated Entry Advisory Committee. The Skagit County Public Health helps facilitate that. And Community Action staff have not been happy with the system because they have to say no a lot because there aren't enough programs or slots for people. Partners haven't always been happy with it either. Dulce, what are some of the things that group, that these partners working together have done to try to improve the system over the last few years?
I think one thing that really speaks highly, and I'm really proud to be part of this Coordinated Entry Advisory Committee and work with all of these awesome partners, is that we know that this isn't a perfect system. And like Stephen was saying earlier, we are constantly working on our communication, making sure that we are connecting with each other regarding mutual clients, making sure that the client doesn't have to retell their story again, maybe getting connected to other providers and making sure that we're getting as many folks access to this coordinated entry system. And that means working with our outreach team, getting in contact with folks who've never entered the system ever, and reaching those clients as well.
And what are we talking about in Skagit County? We know that in terms of the scale of the problem, Skagit County has one of the lowest vacancy rates in the state. So housing is very hard to come by and it's very expensive. And nationally, we know that when those things go together, there's higher rates of people experiencing homelessness. So what are the different ways we measure homelessness by the numbers in Skagit County?
The different ways, one major way, an event that happens every year is through the annual point in time count. And that it gets a snapshot of a count of people who are sheltered and unsheltered who are experiencing homelessness on a single night in January. And that's typically the last Thursday of January. And that is a huge collaboration between partners, making sure that we are geographically capturing all of the districts and all of the clients who are experiencing homelessness that are either sheltered or unsheltered. And that gets a real, it's not perfect, but it is a snapshot of what homelessness looks like in our county.
And do we have an estimate of what it was this last year? I know we do the surveys and then Commerce has to get back to us and it often takes forever, but do we have a guesstimate of what the point in time count numbers were this year?
A guesstimate would be about 250.
And what about the housing interest pool itself? How many households are on the housing or individuals? How do you count that?
So the way that we count that, we count every person that's enrolled into the housing interest pool is either at risk of homelessness or experiencing homelessness at the moment. And that's one way that we track it. So by pulling reports through our data systems. And at any given moment, we have about 500 people in our coordinated entry system, which is our housing interest pool.
Well, we want to talk about the solutions. We know that there's been some challenges for example, I think the county has been working with us and Anacortes Family Center and others on some kind of clunky things that they require. Can you just mention a couple of those things that we're working together with those partners to fix in the system?
Definitely. So we've struggled with exchanging intake packets with our providers. One huge barrier that might seem kind of silly is faxing. So that's one issue that we've been working on with our partners and with Skagit County Public Health. And we're working on seeing maybe different alternatives. But this is not something, this is a requirement that the Washington State Department of Commerce has told us. And
so the Department of Commerce says you have to fax information because it's more secure than sending an email.
Yes.
Okay.
It's
so that's
either
not
faxing or hand delivery.
So there's challenges like that we're advocating within the system to try to clean those things up. But let's turn back to care coordination, and I am going to share we didn't want to overwhelm with charts and graphs, but here's the old-fashioned model of coordinated entry. Can everyone see this? So in this old clunky system, if there's 500 households or 500 individuals that have presented to coordinated entry as literally homeless, and again, that's by HUD's definitions. Whereas like the school district counts couch surfing as homeless, the OSPI, the Office of the Superintendent of Public Instruction, counts kids and families homelessness differently. It's a lower threshold, and it's a much higher threshold for HUD's definition. So of those 500 folks who present with coordinated entry, because there aren't enough program slots, only 25% of them get case management. And the other 75% are essentially on a wait list. If they're not vulnerable enough yet, they get information, they get resources, but there's not case management money in this current system for that to happen. 75% are on that wait list. And the state average is that only close to 12% of people who come through that system exit to permanent housing. Did I get that right, Sandy and Melissa? So this is what we're doing now. We can't fix the problems that are baked into coordinated entry from the feds and the state. We're doing the best we can in collaboration here in Skagit County. And the goal is that anybody who presents, whether or not there's a program for them to go into, will get care coordination, that case management. And what we've seen from Coastal Community Action elsewhere in the state is that upwards of over 65% of folks who do present to coordinated entry are finding how or are able to exit to permanent housing with that coordinated support, with that case management. And that's another community that is also dealing with a terrible housing crisis. So even though there isn't a lot of housing, people are still more successful when they get what Stephen was describing, which is that relationship with a caring human being who walks alongside them, puts their interests, puts that person's interests at the center, helps them set goals, and like Vernon and like Marissa and like Stephen's team, providing information, providing tools, connecting them with other service providers in the community, and the results are much, much better. So I know that we only have about 13 minutes left before we turn it over to Q&A. Anything else that anybody from our team wants to add to that story we just tried to tell?
Liz, I'd like to add to it. My name is Sandy Finney. I'm a division director at Community Action. And I know, Liz, one of the things that you mentioned early on is that one of the things we've been doing is restructuring in order to be able to do more of this, which is really important. And what I wanted to call out is that we're not just doing more of this in the Valley, but rather we're doing it in other places as well. So for example, we have other resource centers. In addition to our resource center in Mount Vernon, we have our East County Resource Center that serves hundreds of people upriver. And one of the things, and they're already doing this work, but this month we'll be hiring a new care specialist so that we can really deepen and expand the ways that we're engaging our residents and participants up there. And I think that's going to see a real change. So that's one way that that resource center is making sure that these services are accessible to people who may have barriers with transportation and housing and things like that. Additionally, as Dulce mentioned, this is very exciting. Today is the first day of our soft opening of our Anacortes office. We are temporarily co-housed with Anacortes Family Center, which we're very, very grateful for while we work on a permanent office solution. But the other thing that's going to be really exciting, and we've been doing work with Anacortes residents for a very long time, and we serve 700 to 800 unduplicated individuals per year in Anacortes, but being able to have a presence in Anacortes is going to make these services, including that care coordination, intensive support, much more accessible to Anacortes residents. So it's really exciting that we've got a presence there now. And right now, with one staff person being in the office, it may be very light touch at first, but we can still connect them with the care specialist. As we deepen our engagement in Anacortes and our presence, we'll be able to make sure that that care coordination is available to Anacortes residents who need it. So exciting wins for us to celebrate. And Dulce, thank you for being out there today with Michaela on our first soft opening day. Appreciate it.
Well, this is really exciting to be in the middle of the transformation. Often feels like chaos, but to see how far we've come is super, super exciting as somebody who works for Community Action. And what we heard is that both with taking services out to where people are and opening more front doors, we're increasing accessibility. We're working transparently and constantly with our partners to be improving these systems. And increasing case management, always with that focus on the individual client and building a relationship with real people because of the multiple barriers that people face to even choose to opt in to a system, let alone fill out paperwork or access some of these things on their own. So the ways that we end these Brunch and Learns is always with how you all as participants today can help. Number one would be a referral. check out that Recovery Navigator webpage or put that phone number in your phone. See, Ellen Ganson from the Downtown Association is here. Maybe we could do a campaign with businesses so that they know when they have a concern about a neighbor living outdoors, they can call that number or fill out that form and get that individual connected with a care coordinator. So referrals are number one. Obviously, continuing the partnerships and outreach. If any of you are not working with our teams right now, we would love to hear from you from other agencies. And I think, Stephen, your outreach providers from various agencies meet twice every other week or twice a month.
Yep. Yes.
And so that group works to coordinate together so that we're not duplicating, we're not reinventing the wheel, but we're working in collaboration and in coordination in outreach as well as in coordinated entry. Of course, I wouldn't be doing my job if I didn't mention that any of y'all can donate, volunteer, or intern with Community Action, because as you can see, we're trying to do a lot here without the resources to do it. So we're generating new resources and new partnerships to make sure that this is a sustainable model. And then, of course, we encourage you to think about working or telling someone you know to apply at Community Action, because as this transformation continues, we need more help. And so here is our employment page, and we'll put that in link in the chat. We do have time now for some questions from the audience, and I'd like to keep it focused on Community Action and what we've been doing. We don't have time today to talk about the larger homeless system. A couple of the questions that were submitted were about increasing mental health and other supports, which we all know are needed. But let's start with, does anyone have questions or comments about how Community Action is helping to transform homeless services in Skagit County with care coordination? Any questions or comments about how we're doing this or what we're doing? Hi, Jose. What question or comment do you have?
Just some comments. I just want to thank your team for all the work that's being done. I know it's a huge struggle for our community, and I think the only way that we could try and fix this little by little, it's by all of us coming together with the different resources. You know, we have a huge situation and ahead of us, but the more we work together, the better it'll be for us. And so I just want to thank you for all the work that you guys continue to do and continue to be a great partners of us. And, you know, from the food bank perspective, we're happy to participate in any way we can. And, you know, I'm part of Catholic Community Service. So on my behalf, you know, I'll try to do whatever it takes to support your work. Thank you so much.
Thank you, Jose. Anyone else have questions for our team? We can direct them to a specific staff person or just try to answer them generally.
I see one in the questions from Lori Bergerstock. The question was just, are there funds to place people in motels while they're waiting for permanent housing? It's like say, the short answer is no. There are opportunities through Recovery Navigator program. If somebody has like a gap in services, so like one institutional setting to another institutional setting, or leaving an institutional setting into permanent housing, if there's a gap, we can do motel vouchers to fill that. But just in general, like it's just prohibitively expensive. We don't have the motel space in just available anyways. And yeah, it's just something that we would like to do more of, but we can't.
Thanks, Stephen. Well, anything that anyone else from Community Action would like to say to help us wrap up this conversation today, telling the Community Action story of what we and our partners are doing to transform homeless services in Skagit County. Well, Well, if not, thank you all for being here today. And thank you especially to those 16 partners in coordinated entry. This is all about the willingness of folks to partner together and to figure out solutions together when we encounter these problems and systems. Go ahead, Ellen. I saw your hand up.
You would think after COVID, I would be able to manipulate the system so much faster. Thank you. One of the things that I am curious about is as a community partner, we would love to see materials come through to us. You know, we'll get a newsletter or, for example, recently an invitation to share the volunteer event. And it would be so helpful to receive those materials in some kind of format that is most easily shared, either through our newsletter or on our social media, like a JPEG or PNG format. I find that sometimes in the conversion process at our end, there's, loss of it becomes a degraded file and is not so great. So is there a person at Community Action who would be the contact for those kinds of requests and to receive those materials?
Yes, and I'm going to ask them to put their email address in the chat. It's socialmedia@communityactionskagit.org, and Isabella and Josh and Liz get that email and then triage to see what the question is and how we can help. So yeah, ideas on how I like to call it a cabal of good, how to extend the cabal of good of people who are sharing and resharing each other's information about homeless services and resources, Recovery Navigator and all of that. So great ideas, and they will get back to you. I can see them putting it on their to-do list right now. Any other questions or suggestions from the group? Molly, are you raising a hand, Molly?
Yeah, just a question, I guess, because as you look at the vulnerability of a lot of our homeless people, how do we, looking at trying to make it as successful as possible from where they're coming from, how do we look at and from someone that's been homeless for a really long time, graduate them to an apartment? I mean, sometimes it's better that they need to be more monitored or that sort of thing to be successful. So then we know that they can work well there, rather than taking someone from sheer homelessness for a long period and putting them in an apartment where they're all alone to still kind of do what they want and they've had no boundaries. I guess that's kind of where I question, what is our best practices to make the success more successful?
Great question, Molly, and thank you for being here today. I'm going to see if anyone from our team, Stephen or Dulce. Stephen, do you want to address that?
Yeah, I think the most important thing is to continue the care coordinator relationship as long as the individual is willing to, you know what I mean? Like, we're never going to end up in a situation where we can sort of control the choices that people make, that we'll be able to, you know what I'm saying? But I think that with continued engagement, continued case management, continuing to work on other goals, right? So like, we've got your housing taken care of, like what's next, you know what I mean? And so we're always kind of working on that model, that as we close one goal off, you know, we're like, what's next, you know? And our goal is to keep everyone engaged long term, you know. And sometimes folks will get inside and they just don't want to talk to you anymore, and that's it. And it doesn't last very long. It is heartbreaking, but we strive to continue the relationship and make that a successful transition.
So it is 10 o'clock, and I think that's a great place to end with the reminder to put our neighbors without homes at the center of solutions, to help them, give them the tools, information, and resources to make better choices, or the first good choice, and then to make another goal and to take another step. So thank you to all of our care coordinators at Community Action and at other organizations, because it is that relationship and walking alongside our neighbors that is going to lead to that improved numbers and the improvements in people's lives that we all want to see. So thank you for being here.